This is such an underserved population that there is so many barriers that we see out here that you wouldn't typically see in a different setting. We're having a hard time getting people to their appointments, having reliable transportation, people knowing what is being explained to them at their appointments. They are coming back from meeting with their oncologist and being so confused and not remembering what the plan is or what kind of medication they're being on.
We've unfortunately had some experiences during those last couple of years where it's just taken them so long to get in, and then sometimes it's been a little too late and past the point of treatment.
I think that the support system in a community, and especially in a rural Indigenous community, is vital for our survival.
I found the lump right at the beginning of the pandemic, and I had to go to every single doctor appointment, every consultation, and everything all by myself. I wasn't allowed to bring anybody with, and it was very hard. I only got to bring my brother with the day I had my double mastectomy. It was kind of hard because when I got home, they were asking me, what did they say? What's going to happen? I'm like, I don't know. I don't remember. I'm just sitting there, and I'm like, I got cancer, and they're throwing all these different long names at me, and I said, well, I'm just going to do chemo, I guess, and then I have to have surgery, and then we'll go from there.
I have talked to people that have told me I'm going to miss my last 3 treatments because I have to pay my bills and I have to go to work. So I can't go to treatment because I need to be at work, otherwise my lights are going to be shut off. And having that decision to make, whether they're going to take care of themselves, their life, to save their life, or to provide electricity and food, those are all things that some people, myself included, never had to think about or stress about, and that's not the case for others, especially for here on the reservation in Hannahville.
I don't like to ask for help. I'm not a person that will ask for help. I will not ask unless I really, really have to. But when it comes to checking for breast cancer, yes, it is very, very important to ask for help. I thought I was just reaching out to the nurse and stuff, and then I had learned about the cancer outreach program, and then I just start going right through her, and then it was pretty easy just going through her for everything instead of having to go with one person, then another person, then another person.
So for somebody that's a consultant like yourself, it's going to be difficult to get that trust sometimes from our Native American patients, and not just the patient, but their family too. They're going to sometimes be on edge, or they're going to be even quiet and reserved in their demeanor, and they may not ask a lot of questions, but that doesn't mean that they're not interested in their own health too.
It doesn't take much to just pick up the phone and ask what you can do or how they're doing for your patient, and just making sure too that you're connecting them with those local resources in their own community where they feel comfortable, and then so they can meet with the traditional healer, they can meet with behavioral health, they can meet with food commodities, anything that you can do to help that person get through this journey in any capacity, even if it's not just seeing them face to face for a doctor's appointment, is wonderful.
I'm using my medicines all day for smudging and prayer, and I need them. I carry them around. I have all the medicines right now with me, and it is definitely important piece to healthcare, health, healing, mental health.
Our hopes are to grow a community that it's ingrained to have preventative screenings done yearly, and that they make their health a priority. So then that is how they grow up, and they know that because they were modeled that from their elders.